After months of measles outbreaks across this country, the Virginia Department of Health is confirming its first case of the year. VDH saying this case is not connected to the national outbreaks. Joel Vasquez is on your side with a look at why health officials are urging parents to get their kids vaccinated. He joins us live from the health department with more. Joel.
Yeah, Riley, the health expert I spoke with tells me that this child caught the illness while traveling abroad. That's why they say that there's no connection between this case and that larger outbreak that's happening across the country. However, they are urging parents to get their kids vaccinated, especially if they plan on heading outside of the country. The first case of measles in Virginia of 2025 has been reported. The patient, a child under 4, who had just returned from traveling internationally.
There's a lot of measles activity in the U.S. Recently, so we definitely wanted to alert the public as soon as possible that Virginia has had its first case this year.
According to the VDH, the child is in the northwest region of the state. They listed 2 medical centers in Woodbridge and Fredericksburg as places of possible exposure and warned people in either one of those places last week to monitor their symptoms for the next 21 days.
Measles is one of the most contagious illnesses that we know of. It spreads very easily through the air.
Virginia joining half of the country seeing at least 1 case, the biggest outbreak in Texas, where the CDC says there have been 800 reported cases with 2 deaths. However, Meredith Robinson with the VDH says there's no connection to these larger outbreaks.
Not out of the realm of normal for us to have someone who's returned from international travel with measles.
And while measles is serious, Robinson says seeing a case is not out of the ordinary.
We see about 1 to 2 of these cases a year in an individual who's traveled abroad and then returned home with measles.
Symptoms to look out for include high fever, red watery eyes, runny nose, a cough, and that distinctive rash that starts at the hairline.
The 4 days before the rash begins is a crucial time because people may not suspect they have measles and they may be out and about in public locations and unknowingly spreading it to others.
Now again, Robinson is urging parents to get their kids vaccinated, especially if they are heading outside of the country. She says 2 doses of the MMR vaccine have a 97% effectiveness rate and offer lifetime immunity. For now in Richmond, Joel Vasquez, 12 on your side.